Hello and welcome. Today we're going to be talking about some freely available resources for patient education. We're going to start with the SALUD project, which is at the University of Illinois, Chicago. So start at the library site, just library.uic.edu. Go to guides, down to nursing, and then SALUD. So this is a guide that was made with the partnership, Cook County and Department of Public Health. So it has a lot of information about just common health concerns. So we have adult health, alcohol, birth control, cancer, influenza, nutrition, obesity, like just a lot of things that you would be talking to your adult patients about anyway. We have them in English and in Spanish. We also have women's health, children, specific to diabetes, consumer health resources, so just another way of saying resources for patients, and then just some additional things that are helpful, not just in Spanish, but in other languages as well. So this is not meant to be comprehensive, but it can be helpful if you have a patient who speaks Spanish as their first language, and you want to make sure that they're getting the information they need to make an informed decision about their health or the health of a family member. Something else I want to talk about is called MedlinePlus, and we can just type MedlinePlus in. You can Google it. So this is for everybody. It's theoretically written at a 4th to 6th grade level, so it's easier to understand. This is written for patients, for healthcare consumers. It was not written for the practitioner. So for this reason, I find it really helpful as a tool to empower patients. You're not necessarily giving them as discharge information. You're telling them, hey, like, I know this is a lot. Here's a website where you can learn more on your own. Okay, so we're going to take a quick look around, start with health topics. This is a bit redundant as far as coverage, okay, you're not quite sure where to look, so you can look in digestive system, or we can look in cancer. Maybe it's cancer, maybe it's something else, but we're going to look in both. Could go by demographic group, health and wellness, diagnosis specific. Population groups is a bit of a catch-all. So we can say adolescents, we can say men's health, pediatrics, veterans. These are all different population groups. Could even look specifically at veteran health. So this is just like a potential place to start. You can also look at drugs and supplements. I find this really helpful because let's say we're looking up very common medication, warfarin or Coumadin. There's a whole bunch of articles. These are all vetted articles, and they're all free for you to access. So let's say I want to click on the first one, and here's a whole bunch of information. Why is it prescribed? How should it be used? Does it go by other names? What should I know? Side effects, storage and disposal. If I forget a dose, what do I do? And because it's Coumadin, we have like a whole ton of important warning. And so we can scroll through all of this. Like, this is a lot, but I personally find it better than that like very tiny font insert that goes in the medications, or just like the do not do things on the prescription bottle. It's like side effects versus, I go, okay, like these aren't terrible, but they're a thing, versus important warning, if this happens, call your doctor. So very, very easy to go through here. So it's drugs and supplements. So let's say I have a patient who's saying she's drinking rose hip tea every day. Okay, nothing wrong with that. But okay, does it interact with any medications? Because when you're asking people what are they taking, they're mostly thinking prescription stuff. Maybe they're thinking over-the-counter stuff like ibuprofen. But a lot of times they're not thinking about rosehip or St. John's wort or ginseng, any of that stuff. So you can look this up too. So does the rosehips interact with anything? Okay, estrogens. If you have an older woman on hormone replacement therapy, interacts with Coumadin. Okay, a little bit with aspirin. So like things to be aware of. They're on these medications, then you need to be aware that it might make your prescription super effective or ineffective. We also have genetics. It's like, okay, let's learn a bit more about genetic conditions. Help me understand genetics. Very complex topic. Medical tests. Okay, let's say like I've got a teenager. I think my teenager might have ADHD. What's that screening look like? What are they going to do? Okay, and having this as either a parent or a patient, it just gives me it helps me be better prepared. Or, okay, like my doctor said I'd do a barium swallow for a test. What's that about? Like, this is just to give them more information. You can also look up medical conditions. Oh, my son had this when he was about 2. He dislocated his elbow, and I learned there's a term for that specific dislocation called nursemaid's elbow. It's when, little 2-year-old decides he's going to hang instead of let his hand be held, and it just pulls the elbow up. So what causes it? Some symptoms. Okay, what exams are the provider going to do? What's the treatment? Okay, I'm now home with this kid that's much better. What do I need to worry about in the future? Again, like very cut and dry, very helpful. Back to the main page. So there's a few other things here. Healthy recipes, health information in multiple languages. Now this is really helpful. Here in Chicago, we have a pretty big Polish population. I do not know any Polish. So I just clicked on the health information in multiple languages, and I click on Polish. So here's all the information we have in Polish. So here's the English. So like, okay, here's what I want it to say. Here's the Polish. So this is done by certified translators who know medical Polish. So you're not stuck with Google Translate. Talking with your doctor. What's cancer? Your lab tests. Okay, whole ton of information here, and you always have the English and the Polish. Now, not all, like, it has a lot of languages represented here, but not all information is going to be in all languages. There's not going to be a lot of patients who have Turkish, so we have a lot less options for Turkish than we did for Polish. But there's still some information there. So this is a lot that I've thrown at you between the SALUD and the MedlinePlus. Again, MedlinePlus, I just typed it into the search bar, MedlinePlus, with the SALUD that's on the library site, library.uic.edu. We go to guides, nursing, and then SALUD. Any questions? I'm Nikki. You can always email me at anicku2@uic.edu. And thank you for your attention today.